Floyd County Health Department, located at 16 East 12th Street, is your resource for better health and wellness. Whatever your needs, we can assist you in finding the right care or connect you to a program that can help. We are committed to improving the quality of life locally by providing exceptional medical services, tracking and preventing the spread of disease, promoting health and safety through education and communication, monitoring area environmental safety, and ensuring our community is prepared for public health emergencies. Find us on the web at nwgapublichealth.org/counties/Floyd or call us at 706-295-6123.
Hello, I'm Lisa Smith here on Channel 4 Southern Exposure. Thanks so much for being with us. This is another segment of the series that we started with our public health department, our Rome Floyd Health Department here in our community, talking about all the myriad of services that they offer to our citizens. And we have Taylor DeBoer, who is a nurse practitioner with our health department, which is located at 16 12th Street in Rome. Welcome. Thanks so much for being with us today.
Thank you for having me.
Well, thankfully to Logan Boss and all of you guys who have had a chance to interview, you guys gave me great notes because I realized that there was things that I didn't know about, but the expanse of what you all provide has been amazing. So thank y'all so much for the notes. So we're going to talk a little bit about what the clinic actually offers that is located there on 12th, which was a SPLOST project back in the early 2000s. And of course, it's just ended up being a real anchor to South Rome, and such a service leader with all that you do. So tell me some of the services that are offered through our health department.
Yeah, so like you were saying, there's a myriad of services. One of them that we provide is vital records, which we give birth certificates for persons born in Georgia, as well as death certificates for those who died in Floyd County. We also have immunizations. So we provide immunizations for both children and adults to protect against vaccine preventable diseases. We also have a TB program, and that helps manage new cases of tuberculosis. It provides preventative services, and it also offers TB skin tests. Other clinical services we have include the Ryan White Specialty Clinic. And this clinic promotes the health and well-being of persons with HIV through providing specialty primary care as well as referrals. We also have a dental clinic, and our dental clinic provides majority of services that most private dental offices offer. And they also operate a mobile dental clinic.
Here in Floyd County?
Yes, yep. We also are part of the Georgia WIC, or Women, Infant, and Children, which provides vouchers to buy healthy foods, as well as providing education on breastfeeding and nutrition to help support Georgia families. Let me see, there's so many. There's also a lot of services for children in Floyd County. Some of those include newborn hearing screening follow-up, Children First, well child physicals, children's medical services, and also ASQ and developmental screening.
So of course in the clinic, besides the services that you just covered, which we're going to go back and review at the end and tell folks how they can find out more information, what they need to bring when they come for their first time visit to seek these services. You also have a large number of women's services that you provide through our health department.
Yeah, and so this is the area that I work in as a nurse practitioner. It's in the Women's Health and Family Planning Clinic. And we're committed to providing accessible, affordable, and high-quality family planning services. These include preventative health care, comprehensive well-woman care, assisting women in planning if and when they want to become pregnant, and providing contraception until that time, as well as providing preconception care and planning for healthy pregnancies.
And how would people go about getting involved in this?
So they can call and schedule an appointment. We also do walk-ins, and so some of the contraceptive methods that we offer are barrier methods, contraceptive pill, patch, and ring, the Depo-Provera 3-month injection, long-acting reversible contraception, and emergency contraception.
So it just depending on, I guess, after a client is reviewed, that's how you would know what exact service they're going to need. And are these long-term clients, or is this a one-time thing, or are you trying to stay with them on an annual basis?
And so both. So we have patients that come in regularly for their annuals that we see every year. We also have first-time clients that just walk in and they want to establish care with us. They've heard about our services. So we see new patients as well and continue have a relationship with them long-term. So we have both.
And what are some of the other? Of course, there's a lot in national media about sexually transmitted diseases, and I guess probably the most amazing is the statistic that a lot of this happens in women 40 and above. So what's the clinic doing to address those issues?
So we provide screenings for STIs, as well as providing education on prevention.
And so is that something in a packet, in a pamphlet, or a one-on-one?
So it's a one-on-one. It's a visit and discussing your history, what needs you have. So that can include screenings, exam, and then we do have some resources and things we provide for patients to take home.
And also, is there medication that they can also get from you as well? So there's a dispensary. Now, how about cancer programs?
So we have a breast and cervical cancer program, and this program provides access to screenings and diagnostic services to women for these cancers.
So you actually do mammograms at the clinic?
We do not do them at the clinic, but we partner with some other local health organizations, and we bring the patients in, we get their history, make sure they're eligible for this program, and then we help schedule that mammogram.
Wonderful. And how many roughly women do you think you serve a year on an annual basis, annualized?
Oh, that is a lot. I feel on a regular week we see at least 25, 50 women, and for all of our services.
And that's just Floyd County women, because there's a health department in every county.
Correct.
That is amazing.
Yeah.
And how about children's services?
Children's services?
For wellness children's services, or immunizations even.
I am not sure those numbers, but I know there's a lot.
It's probably even more than the women that you're seeing.
Yes.
That is amazing. That really is amazing. So what are some other, with the family planning? I mean, is that a series with the significant other and the female? Is it something that's just a one-time with family planning?
So when a woman comes in, we discuss what she's looking for in a contraceptive method, if or when she wants to become pregnant, and in having that conversation and learning her context, we recommend what might work for her and what for contraception. Sometimes women have their partners there, and we have that conversation together, or they have the conversation with their partners before they come in, and what would work for them.
That's great. I'm amazed at the breadth of everything you do. Now, I know with some of your services, like vital records, there is a fee to have your birth document or your death document. But it doesn't take very long at all. I want to say it's like less than a week turnaround.
Yeah, I'm not completely sure, but I know that they can call to know, what they need to bring in, how much money it will be, and the time they can expect to get these records.
And I even went there to get some specialty shots when I was going to actually go out of the country. So you guys also offer that service.
Yep.
So that was amazing. So I guess the best way for people to find out more about the clinical aspect of public health, and especially the public health services that are offered here in Floyd County, that would be what method?
So they can go to our website, which is nwgapublichealth.org, I think. And they can also give us a call, which is 706-295-6123. And from there, they can be directed to what services they're looking for and get more information on that. Or they could stop by and speak to anyone to learn more about the services they're looking for.
What are the hours at the clinic?
Monday through Wednesday, we are there 8 to 5. And Thursdays is 8 to 6:30, and Fridays is 8 to 2. But some of the clinics do have a little bit variation of those hours, but it's only by an hour or two.
Okay. See, I was going to ask you something else. So you probably definitely want to at least start by having some kind of an identification card, a state identification card or a driver's license. And that's something that's very important as well. Well, did we cover everything you wanted to cover today?
I think at least with the family planning, the one thing that we are working hard to promote is the long-acting reversible contraceptives, or LARCs. And it's new to us at Floyd County. We've been offering it since the beginning of this year. And these contraceptive methods include the intrauterine device, or IUD, and the contraceptive implant. And these birth control methods are highly effective at preventing pregnancy. They are easy to use, they're safe, and they're long-acting. But they are reversible, so if a woman decides to become pregnant or she wants to stop using it, she can simply have the method removed.
I did not realize that. But they're higher effective than condoms, even, or the pill? Wow. So birth control's come a long way.
Yes. So for the first year of typical use, less than 1 in 100 women will become pregnant in using the implant or the IUD. And this is in the same range as sterilization. All of those are over 99% effective. Versus the pill, patch, and ring and shot, within the first year of typical use, 6 to 9 out of 100 women will become pregnant. So in the long run, LARC methods actually are 20 times more effective than these other ones in preventing pregnancy.
Interesting. And affordability-wise? Yeah,
so these are very cost-effective methods. A lot of insurance plans cover these methods. If a woman's plan doesn't cover it, or she's uninsured or underinsured, at the health department we offer both the implant and the IUD for $75.
That's very reasonable. And that's the office visit included?
Everything included.
Oh my gracious. So let's talk about, I'm glad you brought that up, Taylor. Let's talk about some common misconceptions. I have a job, so I really can't go to the health department. Is that a misconception?
It may be. It may be a barrier to anyone coming for our services. I think we provide very affordable services, and it really doesn't matter if you have a job. You can bring in proofs of income for sliding scale things for some of our services, or we have flat rate or cash discounts for other services.
But the services are open to the public. You can have a job, have insurance, and still choose to have your health care done there.
And some insurances we do accept as well.
Interesting. I didn't know that either. That's very interesting. Now, for general, I have a cough, I have an ear infection, is that really why you would go to the clinic, or is it more for these specialty services?
More for the specialty services. For those other things, we may refer a patient to their primary care provider.
Or the 24-hour clinics that are around town. Okay. And one of the other things, dental clinic, I imagine that the waiting list for your dental services has got to be a mile long. I mean, because there's such a need. So how do people find out more about that? Is that information on your website?
Yep, it's on our website, or they can call. But it's a great clinic. They do offer pretty much the same services as any private dental.
Including extractions?
Yep, oral surgery, cleanings, extractions. They also work with the WIC program and pregnant women and helping them get their cleanings and dental health. So it's a really good clinic.
You know, and I think a lot of times, especially you coming from the healthcare industry, can speak on this much more than I can, but so much of your health and your good health starts right in your mouth. And when you have infections and bad teeth, that just, it causes havoc in all of your internal organs even. And I can't even imagine having that situation and being pregnant.
And good dental health is really important during pregnancy too, because any infection that can happen in the mouth, it causes this inflammatory response, which can increase risk of preterm labor because of that inflammation. So it's really good that we recommend women, especially pregnant women, to seek dental services and have regular care.
So if you have insurance or don't have insurance, or you're right there where you have a job but you have a job that has insurance, your doors are open for business. And you are here to serve the better good for our citizens and provide good health for them on many levels. And give us that phone number again, please, Taylor.
Yes, it is 706-295-0000. 888-617-6123.
Great. Did we cover everything you want to talk about today?
I think so.
Okay. Well, welcome. Thank you so much for the services that you provide as being in our medical healthcare practice, and of course being in public health, which is even just just amazing to be able to know that you're touching so many lives, and especially lives that maybe couldn't afford good health care. So thanks for what you're doing.
Absolutely.
I'm Lisa Smith. My guest today has been Taylor DeBoer, and she is a nurse practitioner with our public health department here at 16 East 12th. Please go by and see them and get involved in the services that they offer so that you can be a healthier you as well as the members of your family. Thanks for joining us today on Southern Exposure.
Apparel accessories provided by Blue Sky Outfitter on Broad Street in downtown Rome.